hand hygiene. Open package away from you. Your handy dandy little trash can. Shiny side. Keep an eye on your sterile field. Apply sterile gloves. Spread your fingers. So you got your sterile field, sterile thumb out. Fenestrated drape. Shiny side out, if there is one. Without letting your sterile gloves touch non-sterile surface. One-inch borders. Separate your trays. Okay, white chili. I already had one in there. I'm going to open it. I don't know why I got that one there. I'm going to put it right in here. remove the plastic sheath from the catheter, keeping control of the catheter. Tightly attach syringe to the inflation port. Inflate the balloon, looking for manufacturer defects, such as, will the balloon inflate? Does it leak? Will it deflate? I'm just going to check, make sure I got that connection tight. Everything goes back into the box. Your edges are not sterile. Try to keep everything inside without touching edges. Just going to dip that into the KY to lubricate. I'm going to turn my box a little bit. Making sure that I'm ready to contaminate the non-dominant hand. You open the labias of the female. The first cotton swab is far labia, front to back, without crossing over anything, and into the trash. Discard. Second cotton swab near labia, without crossing over, and discard. Third cotton swab straight down over the urinary meatus, and discard. Dispose. I'm going to bring this up. It works directly in front of the patient. Grasp your catheter about 3 to 4 inches away. Thumb and index finger keeping the labias open with the other hand. And these 3 fingers bring the catheter into the palm of your hand. Insert directly into the urinary meatus for 1.5 to 2.5 inches before you expect to see urine. When you see the return of urine coming through the urinary drainage tubing, insert what I say is another generous 2 inches. Release the labias with your non-sterile hand. Bring up underneath the dominant hand, which is your sterile. Get your syringe. Look at your patient's face while you inflate the balloon. Pull back on the catheter till you meet resistance insert back in 1 centimeter to get the balloon off of the internal sphincter, disconnect your syringe, you can change your gloves, don non-sterile gloves for cleanup, okay, I tore my gloves, but won't pretend like I did. All right, so as you know, at VGI, what we do, we're going to remove the drainage bag from the box, discard here. Now at VGI, in reality, you tear your fenestrated drape, but here at VGI Hospital, we remove genitalia from the patient. The genitalia back. Let your patient know that she can relax. Position her. The urinary catheter is to be on the female, attached to the inner thigh to prevent pulling of the catheter or any pressure being applied on the labias. The catheter should loop out comfortably. The drainage tubing always goes over the patient's leg, never under, where it could get kinked, which would stop urine flow. And of course, the drainage bag is attached to the non-movable part of the bed, which basically is the bed frame. And then you have your continuous gravitational flow of urine. Make your patient comfortable, neat and tidy. After the insertion, there's going to be the antiseptic will be on the labias and the KY jelly will be on the labias, so we need to do pericare of the patient before we complete with them. So make your patient neat and tidy. Call light will be in place. Put your bed down low. And perform your teaching, which is in box 29-3. And we'll review that in the skills lab more before tomorrow. Stop.